We're just integrating care for your whole body. Like, we don't want to just focus on birth control. We're like, what can help you with birth control and maybe your headaches and maybe your joint pains? What else is wrong? Are you happy? Like, do you enjoy
happy?
things?
Right. What a question to ask a patient. They probably go,
we would never have done that in the
"Whoa."
past. Right. I would have just wrote a prescription for birth control pills. Mm-hmm.
Hello. Welcome to the Dr. Gill Show. This is where we talk about medical matters that matter to you. My guest today is my good friend, Dr. Jennifer Sue. Welcome to the show, Jennifer.
Thank you for having me. I'm so glad to be here with you.
What a pleasure. Jennifer is an OBGYN by original training.
Mm-hmm. Yeah.
Was a colleague of mine, is still a colleague of mine, but was doing...
For like 20 years.
20 years almost. And she had a very busy OBGYN practice, and me being as an OBGYN subspecialist in reproductive medicine and fertility, we would refer patients back and forth. You'd refer some to me, they'd get pregnant, go back to you for obstetrical care, a beautiful professional relationship. But sometime, was it 5 years ago, 6 years ago? What happened? Did you talk to Dr. Chris Link or have an interaction with Chris?
The Chris Link. Dr. Chris Link is amazing. But
he does integrative medicine,
yes, he
doesn't
does. But first of all, thank you for taking care of our patients all these 20 years.
What a pleasure. We just saw one this morning.
Yep,
we came in early this morning.
Yes, you fit her in. You started your office early just to see her, so we thank you.
Yeah,
all of them love you.
And by the way, she has a big pelvic mass. She can't wait. She can't wait.
It's huge. So I knew it was yours.
She needs surgery, and we'll fit her in.
I'm like, this is big.
And it's urgent. So we saw her. My pleasure.
Dr. Chris Link is in Jefferson City, Missouri. He started something called integrative medicine in Jefferson City, which was unheard of. No one understood what he did. They thought he just had acupuncture. He thought they didn't know what he was up to.
Was he a family doctor?
He
or
was
an
an ER doctor.
An emergency room doctor, which ER doctors are broadly trained. They have to know everything.
He paved the way. He is the original integrative medicine doctor in Jefferson City, Missouri. In fact, how you remember, it's so weird you remember when I quit OB. I actually had to quit OB because after practicing for 20 years, my health was a wreck. Like, I didn't sleep.
Right.
Yeah, I was 24/7, which meant I just took call all the time. I had my own patients, which I loved, but you're on call 24/7. You don't get a break.
Yeah.
But the people in town still help me. Like, if I had to go and take a vacation, they cover.
Sure.
But otherwise,
obstetrics is for the young.
I was eating horrible. I was eating like 5 candy bars a day. Anyone can remember that. I was not sleeping, and I was exercising, but my diet and health was horrible.
So you interacted with Chris Link.
Yeah, because he had to save my life because I got so sick. At the age of, how old was I? 45, I had 2 cases of pneumonia. My heart was beating irregularly, and I was allergic to gluten and something, which
it was
I'm
running
Asian.
you down.
I shouldn't be allergic to gluten because I'm Asian. So Chris Link saw me as a patient. And actually, I canceled my appointment because I'm like, he's kind of woo-wee, and I don't know what woo-woo-wee. And I'm like, I don't know. So I canceled my appointment.
Crunchy granola.
I did. I made the appointment, canceled it. Then I'm like, let me just go and try it again. And he got me so well that my husband was amazed. And he said, I was in the bathroom one day, and he yells from the study room, "Hey, sweetie, Dr. Link graduated from University of Arizona, Center for Integrative Medicine with Dr. Weil. Do you want to try and get in?"
Yeah.
Because he's a pain management doctor. So
your husband is a pain management
doctor in Jefferson City, Missouri. Dr. John Lucio, that's my husband.
Lucio, okay.
So we both
We're going to have him on the show.
He would love to just
be able to help
patients.
So your husband saw an improvement in your health.
Big time, 110%. So we had to apply. We had to get an essay written. We had to be accepted into the program. It's just like getting into college.
Did he apply too?
Yeah, at the same time. But the funny thing is, he gets accepted, and he goes, "Sweetie, I got in. Check your email." I'm like, "I didn't get it." He goes, "What?" And I know, and I could barely see patients because it was a Tuesday, and I'm like, I didn't get it. And I'm like, let me check your breasts. I'm not crying, don't worry.
Right.
And then like,
I mean, your patient's breast.
I was
you're doing
my
an
patient's
exam.
breast,
Okay.
and like I'm like trying to concentrate, and so he called the who was the woman who was doing all the admissions? He's like, can you just see if my wife got in? Because of the two of us, I would think she would get in more than me. And she goes, there was a glitch in the system. She didn't get her email. She got in. So then we spent.
So you asked nicely.
He did great. And so
you got accepted.
I had already gotten in.
And then did both of you go to Tucson?
Yeah. So we were both in the graduating class. It was 2 years of an intense study for 2 years.
2 years. This is not a 2-week certificate. This is a 2-year program.
It was so hard.
Now, plus, did you do it remotely?
It was online. It's online with a week each year at the Westward Look Resort. So that's where they did our in-person classes.
Okay.
So then it was horrible because I'm now, how old was I? 47, trying to take an online course. Like when I went to school, I had like highlighters, I had books. I'm like, how do I do this? It was so hard. Anyway, we graduated class of 2019. Yeah,
2019. And he graduated.
At the same time. It's so cool.
Now, is that a degree? What
it's a degree.
It is a degree.
Yeah. We had a fake shawl. They didn't have the cap and gown, but they had like this fake that
but
one.
It's a real
dream.
recognized.
I know. We graduated with our whole class.
So Andrew Weil doesn't really need any promotion.
Oh my gosh.
He's a famous guy. But let's just say he went to Harvard Medical School and had a feeling. He had a feeling this wasn't the whole thing. He says that he was learning how to manage disease, not foster health.
Yep, not giving the patients any tools to be healthy themselves.
Yes.
Like, all we do as traditional allopathic physicians is what? We help people. Like if you're sick, you come.
Right, we treat the disease.
Yeah, why don't we prevent that to begin with?
Right.
Yeah.
Right.
It's called well care.
So, in the arc of Jennifer's story, you were working yourself to death and you were getting sick.
You knew me then. Yeah.
I know, but everyone,
like you knew me. Yes.
We're no stranger to burnout. I know I'm a solo doctor. I know how hard this is.
Well, you know my health history. I had endometriosis, fibroids.
And fibroids.
All because of what? Estrogen dominance? Cortisol, inflammation.
Doesn't help, let's say, plus genetics and whatnot.
Mm-hmm.
Asian women get fibroids more often than Caucasian women.
Oh, I actually didn't know that.
Yeah, and African women with African blood get them even more.
Are you serious? My mom had it. My mom had fibroids and endometriosis.
So I'm going to stay on topic here. We could go so many fascinating. Right, we could talk forever. So I'm going to talk about the arc of your personal development. So you get this degree in integrative medicine, and I want to learn more about this, and that's what I want you to share with us. But I just want to bring your personal story around, and then did you have to say, you know what, I can't do OBGYN 24/7 anymore?
Actually, it was Dad that did it, because Dad was an OB-GYN for 45 years, and so he developed liver cancer in 2015. He had a liver and kidney transplant. Yes, Dr. Philo.
And he just passed away.
Thank you for remembering. Yeah, a month ago.
Bless his heart. He had a wonderful reputation, and he had a lab. What a special guy! And he was an
integrative OB-GYN before it was ever integrative. Mm-hmm. He brought husbands into the delivery room because at first they were always in the waiting room. He did connection of baby to mother and dad by no stress. They'd turn the lights down. They'd be quiet births. With the babies, it's called Laboyer birth. Beautiful, like you hold the baby underwater with the water covering their ears, so it's muffled sounds. It's just amazing. He brought so much to women.
So he integrated all kinds of stuff.
Yeah.
Wow.
So anyway, he got so sick because he had a liver and kidney transplant, but that went fine. Barnes did a great job taking care of him, but he had 2 strokes. So Mom was like, you've got to quit OB. I need you up near Barnes a lot more. Because the groups in Jeff City were covering me all the time. So I quit OB.
So you had to take care of your family. Yep. And that's so hard, taking care of your parents.
Well, and that's why the whole practice exploded busy, because I took on all his patients and I was 24/7. And then my health went.
And it was killing you slowly.
It was killing.
So you made the decision to go into integrative medicine. What do you call it? Integrative GYN? So you do.
That's what I do call it.
So do you see mainly women?
No, I see men too, because ACOG, which is American College of Obstetrics, I'm still boarded by them. I still take my boards traditionally, allopathically, but they want us to treat the male partners. Because oftentimes when we
Really?
help the women, they want sex more. They're more happy.
Yeah.
And then the husbands need treatment because they got erectile dysfunction. They've got a gut. They've got man boobs, and they're like, you need to see my husband. So they actually encourage us to see the male partners.
That's interesting because in infertility, I'm intimately involved in treating the men.
Yep.
Their sperm, their hormones, their
cool.
libido. Oh, yeah. I evaluate men.
You do very good sperm analysis, too.
We do the best. Now, I do use a specially trained urologist here in town, Dr. Mecklin. He did a podcast with us already. So I don't examine. Oh, yeah. I don't examine the guys, but we integrate the couple together because it takes two to tango and make a baby.
Oh, I mean, the questions on your questionnaire are always like that. How many times do you have sex? How many times a day? Like, you're so open with people. Anyway, we got to talk about that stuff. It's integrative gynecology.
So that's what you do now, integrative gynecology.
Yeah, it's a lot of fun.
So you get a regular sleep schedule now. You're not up all night.
Schedule. Yep.
I assume you're eating better because now you know, and I want you to tell us about that. And you have some other interesting pursuits or avocations.
You know, I always, because of the yoga.
I'm going to brag on you. You used to teach Zumba dance.
Zumba.
You have a Zumba studio.
Yep.
You teach yoga, and now you're teaching hot yoga down the street?
Yeah, Sumit's hot yoga.
Do they know you're a doctor? Do they know that it's a board-certified medical doctor?
They do.
Giving their hot yoga class?
Because as physicians, we've got to give tools to our patients to regulate their cortisol and detox because our whole environment is toxic.
Oh, it is.
Plastics, BPA this, BPB this.
These microplastics, endocrine disruptors.
Yeah, we can't get away from them.
Chemicals. They just get smaller.
Yeah.
The particles get smaller, but they don't break down. These Teflons, these chlorofluoro chains get smaller, but they don't break down.
See, that's you. You always read. You know so much beyond a typical repro endo.
Well, thank you. Yeah,
it's always been like that. Always.
Well, thank you. So we've got these forever chemicals. It's disrupting our hormones.
Yep.
Fertility is increasing. Infertility is increasing.
Is it really? I wondered. I wondered.
On many fronts, and for many reasons, our reproduction rate is going down. I forget the name of the number, but to have a stable population, Jennifer, a couple needs to have 2.2 kids.
Okay. Because
some kids don't reproduce, some kids die, and blah, blah, blah. 2 isn't enough. And I can't believe I'm forgetting what this number is, but in the United States, I think it's 1.8 or 1.6. In Italy, it's 1.2 or something. Their populations are crashing. Wow. And in China, it's terrible. China is about ready to have an enormous population decline due to declining fertility rates.
I mean, Zumba for health is amazing because anyone can Zumba. Zumba's strength is you can go do your own thing in Zumba class as long as you're socializing. And that's the strength of Zumba is you're talking with people. Zumba students do not leave class. Like you go to Pilates, you go to HIIT workouts. Once you're done with your workout, you're out the door. Zumba students stick around forever. And then what? And then
socializing.
It's socialization, which is one of the pillars of health.
All right. So tell you what. So that's a perfect way to begin to integrate or bring this stuff together. Dr. Weil says integrative medicine is not alternative. It's not just holistic. It's not complementary. It brings it all together. It's an intelligent combination.
Yeah. Like I don't go around in my office with like hemp hair and hemp clothes. I'm an allopathically trained doctor. I'm boarded in American College of Obstetrics Gynecology. Now just gynecology. Like we're normal doctors. We're just integrating care for your whole body. Like we don't want to just focus on birth control. We're like, what can help you with birth control and maybe your headaches and maybe your joint pains? What else is wrong, right? Because a lot of patients, they still come to me, I just want birth control. And I'm like, okay, tell me how your orgasms are. How's your sleep? Are you happy? Like, do you enjoy
happy?
Things?
Right. What a question to ask a patient. They probably go,
never have done that in the past. Right. I would have just wrote a prescription for birth control pills. Mm-hmm.
So what are the things you look at? Let's say a new patient comes to you, Jennifer. What are the things you look at in bringing this wellness, this health promotion model together for a patient? What are the things you look for?
It starts at the beginning. They walk through the door. Are they like nervous because there's other people in the room? Those people are usually introverts. So I'll be like, come on back, and you could just fill out your form in the back, right? So it just starts with coming from where a person is, because not everybody likes to be in a waiting room. Not everybody likes to fill out a form. Maybe they can't read. Maybe there are different nationalities. So it starts from where they come from.
So you're assessing a person right from the very beginning.
Like you can tell. Like most of my hormone patients that needs hormones, they are not going to sit down. They're antsy. They've had it. They grab my paper. They're grabbing the pen. They're writing fast because they have no tolerance for anything. So I'm not going to be all cheerful like I am with you. I'll be like, fill this out. Don't worry. You're not going crazy. Just fill it out. So whatever you can do, come on back.
All right. So you adjust your...
Just assess. Yeah, meet them where they are.
Way of interacting. Okay, so patient comes in. Yeah. Now you have to, I call it peeling the onion. You get all this information and you work your way down to a core understanding.
Yeah, I usually just talk. By the time when they hand me the paper, I'm like, oh my gosh, I love your hair. Then they start talking about their hair. Then I talk, and then I see, how are they interacting with me? Do they really like doctors? You can usually tell if they don't like doctors.
Oh, yeah.
It takes a lot for them to get in.
For me, it's usually the husband in the corner, nervous as can be.
Yeah, like with the hands in the front.
Like, and ignoring, and they're on their phone.
He's going to ask about my ejaculation.
Please don't ask me about sperm. Please.
And then I'll usually kind of just assess, like, hey, what do you do? Did you just get off work? Like, what do you do for work? Then I can find out, like, are they stressed about certain things? Just talking. I typically talk to them like I talk to you.
Okay.
By the time they come in, they've known about all my 15 bad boyfriends. They know, like, what happened to mom and dad. They know everything about the office.
About you.
They know my straps aren't staying up. They know everything about me. So then they relax. Then by the time I get in the room, I don't change them. Like, before, my nurse met them, took them to the room, undressed them. Then I come in, hi. Nice to meet you. My name's Jennifer.
Oh, yeah, they're already defensive like this.
Now they stand
vulnerable.
Yeah, and I just literally ask, if you're a new patient, what do you want from me? Like, what do you need?
Oh.
And then I let them talk because, our training, they're like, patients really don't talk that much. We think they talk forever, but it's really on average 2 minutes. You can spare 2 minutes. Let them just talk.
Okay.
So that's about it. And then I kind of just go, okay. So what? And then I just go like, how's your sleep? I go through the 5 pillars of health like you do. How's your sleep?
Let's talk about it. All 5, please.
Like, how are you sleeping? That's less like defensive. How are you sleeping? Everybody likes to talk about their sleep.
Okay.
Then it gets more detailed. Like, how are you moving? Like, are you moving at all? Like, exercise wise, I typically don't like exercise because some people don't like exercise, but they move. They garden.
Sure.
Yeah, they run around with their grandkids.
Right.
And then the third thing's always like, how is your eating? Like, are you eating 3 meals? Are you eating 5 meals? What kind of things do you like to eat?
Okay.
And then number 4th is always nutrition or vitamins. Like, how are you getting all of your necessary trace minerals?
Oh, interesting. So it's kind of a subcategory of nutrition. Yeah. Okay.
And then the 5th, is hormones. And I don't say, how are your hormones? I just say, hey, are you moody?
Okay.
Do you have sex drive? Is your sex drive the same as before? But usually Dad taught me, Dr. Felisu taught me, don't ask how's sex, because everyone will say, fine.
Fine.
So he says,
don't ask me anything more.
When's
it's just
the last
fine.
time you all had intimacy?
Intimacy.
And if it's been 5 months, there's a mismatch. Something's wrong. Like, there's a mismatch because that's not typically what people need. I know.
Right,
and then you got your whole time, because we're direct patient care. We are out of network with all insurance, so they're not rushing us through our visits. So I got, what do you want to deal with first? And I'll say your sleep seems fine. Let's get into your diet. Like, what do you like to eat? What's possible? Some people don't have access to really organic foods all the time. What do you think you can do? We go through what's healthy and what's not.
Well, I want to put a fine point on something you just said.
Yeah.
If you go to an internal medicine doctor or a family practice doctor, especially one that's run by corporate medicine. The doctor has to see 6 patients an hour.
Absolutely. Yep.
That means they have 10 minutes per patient, which means if they can type really fast and are good with an electronic record, I am not, it means at most they have 6 minutes with you, which is grossly inadequate. But a lot of these doctors are under so much stress.
Yeah.
If they don't see 6 patients an hour, they get fired or they get reprimanded or something like that. So if it seems like your doctor only doesn't listen to you, it's because they don't have time to listen to you, and they're going to just write a prescription, order some tests, and bzz, you see the dust as they run out the door. And I can tell you the doctors don't want that either, but it's what it has come to. So if someone comes to you, Jen, what do they have, about a half an hour of undivided attention, an hour?
As long as they need. I typically, for a new patient, have an hour. It's an hour set,
so
and that's
they get
plenty.
an hour. And I want to say this again. If your doctor only has 6 minutes with you, they want to spend more time with you.
They do.
99% of your doctors don't want to be forced to do it in 6 minutes. Nope. And it's stressing them out too, by the way.
Yeah, it's true.
And they know they're missing things.
It's true.
Now, some people will call this elitist. Some people will call good food elitist. Some people will call shelter. And I acknowledge.
I do too. Good point.
I acknowledge that here in the United States, we have it better than 99% of all the people in the world. No, I'm not a scholar of the Bible, but I know that when they were anointing Jesus with oil, one of the disciples said, "You're wasting money. What are you spending your money on the oil when you could be giving this money to the poor?" Right?
Yeah.
And I hope I get this right. Jesus said something like, I'm paraphrasing, well, I'm worth it. It is worth investing in what is special to you. All right? I think I've got the concept right.
He said, she is lavishing me now when I'm alive.
Right.
Not when I'm gone.
Not when I'm gone.
Yeah.
Right?
She's generous while I'm here.
So I don't want to be called elitist. If you have the resources and you have the time and you care enough about your health, and you're lucky enough to get time with you, well, that is what it is. And it's a special thing in life to have that.
It is.
And for those that don't have the time or the resources, I'm so sorry they don't.
Well,
but I don't think because somebody doesn't have that someone who can make it happen shouldn't be able to have access to a healer like you.
Well, guess what?
What?
I see Medicaid patients because with the crisis now with healthcare, Medicaid patients cannot see doctors because they don't want to participate in Medicaid.
Oh, I can't take Medicaid. Medicaid doesn't pay me enough to keep the lights on.
So I
can't do it.
I see Medicaid patients.
How?
Because they can afford it.
So they find their own resources and make it happen.
My new patient visit, $250. All their labs can go through Medicaid if they wanted. I do surgery. I have a surgical fee that's reasonable. Like patients know we need to get paid, but my fee reflects the level and the complexity of the surgery, the time away from the office. And so they're happy paid because usually their deductible is going to be paid somehow. They're going to pay somebody.
You still
so
have
rather
surgical
just pay me.
privileges
I
and
do
GYN surgery?
Yeah, at both hospitals.
In Jeff City.
In Jeff City. But I saw a homeless woman 3 years ago. It took 3 buses to come to my office. Aww. She was late, so I'm like, they're late. There must be a good reason. But, you're
3
like,
buses.
They probably stood me up. It's probably not good. Took 3 buses. She had to take 3 buses. She didn't tell me she was homeless. She said, I have $150. Back then, my new patient visit was $150. It was all crumpled up. And she was happy because I showed her respect. She has the means to take care of herself. She has the means to take care of herself. But people can't get in with Medicaid to any offices. So, and they can't afford it because, no offices under insurance know exactly what to charge a cash-paying patient.
They're not even allowed to. They don't have a system for it.
And when they find out $250, I can do that. Like my sister can help, my aunt can help, because they need to get in for care.
Because my health is priceless.
And people are treated with respect because they can pay and they can take care of themselves.
This is a total tangent, Jen, but I've seen these videos on YouTube. Some guy in India, I think it's India, find some homeless guy on the street, and they clean him up and they bathe him and they shave them and they give him some clothes, and you watch this transformation. That's just some care and respect. Can give to almost any human being. It's just amazing. All right, so I'm going to bring this back. So the first pillar of health that you say, so now you've got the time with this person, you care, you've got the respect. One of the first things you review is sleep.
Yeah, I just go, how are you sleeping?
So tell me about what is good sleep, Jen?
It's at least 7 hours a night. At least
7 hours.
Yeah. I'm doing about 8 to 9. But I am 53 years old, so I don't know if it's because I'm sleepier. Dad died. I don't know if I'm like depressed, but I'm averaging about 8 to 9. But at least 7 is for health.
No, it's also called sleep hygiene. I hate that term. Hygiene.
I think we should name a dog named Hygiene. Hygiene. Hygiene.
So what are some of the things you would recommend for a good night's sleep? Now, this is what I know.
Oh, yeah. Tell me.
Obviously,
you know it already.
Well,
you do.
Well, I'm getting older. I don't sleep as well as I used to because I have to get up more often. That's all. What we had a podcast on that.
You are
last
on call
week.
375.
Well,
how many days are in the year? 365 days a year. 24
yeah,
hours
I
a day.
take a lot of calls. I'm solo doctor.
Because eggs are there. They need to be.
Well, I get to sleep more than you did doing obstetrics, and I knew that when I trained that I was not going to live very long if I had to be up all night delivering babies.
Yeah.
So I did the extra years of training so I didn't have to deliver babies all night, although I love delivering babies. All right, so for good sleep, you need a good mattress. All right, you need sheets that you're not allergic to so you don't get a headache, blah, blah, blah. You need a dark room.
Yeah.
It needs to be dark. I used to sleep with the TV on, and sometimes that still happens.
Just
I'll fall asleep.
Yeah,
because I fell asleep because I was watching TV. And so you need a dark room. You need not to have distractions.
Yeah.
Do you think my wife thinks that electromagnetic fields are really bad, so she doesn't want my phone charging near my head, and she'll move away.
Right.
She's right. She's right about most things.
What's her name again?
Regina.
Yeah, oh my gosh, she's so pretty.
And she's right. She's very smart. So, okay, let's say it's controversial, but maybe try not to have your phone charging by your head. Okay. So it's dark, good mattress, quiet. Man, how about airflow? Is it nice to be a little cool?
Yeah, actually, cool. Yeah. See, you already know this. About 68 degrees is the optimum temperature to sleep, 68 degrees Fahrenheit.
Last week, we slept in a teepee in Wyoming, and it got down to about 42 degrees. And it was delightful.
What?
But you have to have a warm, I'll show you the picture. We were in teepees.
What?
But we had the super warm blanket, and it was just wonderful. I had my beanie cap on and a warm blanket, but having the cool,
Did you wake up with
air.
like frost on your eyelids?
No, it wasn't that cold, although I have slept in very cold conditions.
I watch people like you on YouTube.
Yeah.
That, like dig out the hole in the snow.
No, I'm not that hardcore.
Zip-up
But my boy Hunter, he is an Eagle Scout, and one of the things they do is they sleep out in the cold, and they get a blue bead for under freezing,
Did it?
and he gets a white bead for under zero.
Hunter.
A clear bead for under. Yeah,
Nice.
There's Hunter. Yes.
Aww.
So, all right. So good sleep. Those are elements of good sleep.
Your wife's actually right. I mean,
is there any data to suggest sleeping alone or with a person? Obviously, if somebody's tossing and snoring, that's
I don't
not
know.
good.
That's such a good question.
I always
Chris
sleep.
Link would know. Chris Link would know that.
Chris, well, we'll have to have Chris on the
dial a friend.
So, all right. So there's no data. I sleep better when my wife's next to me.
I think men do live longer with spouses. I do know that. They live longer with a spouse.
So
but
sleep is important.
What Dr. Chris Link taught us was that the eyelid is very transparent. So even though my eyes are closed when I'm sleeping, if you have your blue light facing up, which is any computer screen, your cell phone going off when you get a text message, a notification, it is coming through your eyes and disrupting your sleep.
Okay.
And another thing, what was the other thing you touched on that was really good? Things that people take like Benadryl, Tylenol PM, Benadryl.
Yeah.
Diphenhydramine is extremely not a good choice because it knocks out REM sleep. So REM
that's
sleep,
important. Now, Benadryl turns me into a zombie.
for like how many hours later?
A long time.
See?
Not good. I can't take it during the day and function as a doctor.
No.
Can't do it.
Well, it knocks out REM sleep, so people know they slept, but they're not rested.
They're not rested. This is a huge point, Jen.
Yeah. So, I mean, I used to prescribe this all the time to our pregnant women. Oh, take Tylenol PM. Take Tylenol. It's safe for the baby. But if you can avoid Benadryl or diphenhydramine products, it would be best, because if long-term use of diphenhydramine, you're knocking out your REM sleep. And long-term, you'll get depression if you don't dream. REM sleep is a stage where we have all the great dreams about catching your big fish.
Right.
What's the biggest fish you've caught?
Oh.
Hunter's here, so you can't lie.
I've caught some big fish in the ocean, really big. I caught a shark once. It was very big.
How do you put it back? Like, oops, sorry.
That one got away.
Good.
Oh, my goodness. I've caught a
that
27-pound striper in Arkansas. I've caught huge salmon.
I'm Asian, so I'm like, ooh, yummy.
Yeah. I caught my biggest rainbow last year with 7 pounds.
Oh, you're a good fisherman. I just like watching your stuff on Facebook.
Love to fish. It's
with
therapy
you and your
for
waders.
me.
When I see you, I don't think you in like the microscopic goggles when you're doing the tubal reenactment.
Right. I'm doing microsurgery. Yeah.
I'm thinking of you and your
Holding
waders
up my
holding
fish.
a big fish.
Yeah, I caught almost 20-pound trout in Pyramid Lake in Nevada. They're called.
I would be screaming like crazy, like.
They're called Lahontan trout. Okay. Oh, you got me going. So getting back to sleep here, I have a patient. A lot of patients take hydroxyzine. It's also another.
What's hydroxyzine?
It's a very powerful. It's a Vistaril.
Yeah.
It's a very powerful antihistamine, which also is sedative.
Yeah.
And people take, because it's non-addictive, they take it for anxiety attacks and for sleep. So that's another thing I bet you knocks out REM sleep.
I don't know about that, but if you want to have them try, if they're open to herbals.
Yeah, please.
Lemon balm and hops. Hops, as you know, sounds familiar. You got lots of bars around the Columbia area. Hops. Hops puts you to sleep. Lemon balm keeps you asleep. So typically, if you go to a good health, actually, I don't know all this steeping and all that and the types of the roots. But if you go to a good health food store, they'll know your answer. But like, there's usually sleep formulas with a combo lemon balm and hops. Because hops will put you to sleep. Just like you drink a beer, you get kind of sleepy, like, oh, I'm chilled.
Right.
And then lemon balm keeps you asleep. But yeah, lemon balm, hops. For people that are typically kind of anxious people, kind of nervous, you can actually give lemon balm in little amounts throughout the day. Just side note. Yeah,
fantastic. So getting sleep. And is there something to be said for regular patterns of sleep, trying to go to sleep at the same time every night?
That I don't know.
Because I find it hard to do.
Like a schedule.
So people say that's the sleep hygiene thing. They say don't take naps and go to sleep at the same time in a dark room. I know. On weekends, I love a nap.
And they always say don't sleep with your pets. But I love sleeping with my pets. And she does wake me up. Our cat walks on my boobs. I'm like, ow, not my boobs. Not my boobs. Don't walk on my boobs. So she'll walk and she'll do little biscuits on my belly because I got a belly, thank goodness. And she does biscuits. But how am I going to tell her not to sleep with me? Right. But you're not supposed to sleep with your pets.
You're supposed to this, supposed to that. I don't necessarily believe all these supposed tos. And I could get into. Okay, go ahead. How
about caffeine? What do you tell your patients?
I think everybody's different.
You're exactly right. Their metabolism's different.
Yeah. Some people can drink coffee and go to sleep.
That's me.
I'm kind of both. I need it to wake, but I don't need it. I like it when I wake up to have a cup of coffee, and I try to avoid it close to bedtime. Yeah. And what really messes me up are the energy drinks. If I have a sip of one of these, I'm not going to name them. I don't want to get sued. But you know that they sponsor all the
ones with
the crazy athletes and the extreme sports. Don't name it. Don't name one. But I have to avoid those. Not good for my metabolism. Okay, moving on from sleep. What was the second pillar of health?
Having so much fun. What did I say? Oh, I'll say movement. Like, what are you doing to move around?
All right, and it's better just to any kind of movement's way better than none.
Where was that good energy doctor? She is so good. She was originally an orthopedic surgeon. I can't think of her name. She wrote the book Good Energy.
Okay.
She was interviewed by Megyn Kelly on the Megyn Kelly show. It basically It's horrible. Like if you're a Missouri State worker, which like 80% of our population work for the state, right?
Down in Jeff City, sure.
They said
state capital
that if you sit for a living, it negates any exercise you've done throughout the day. So the best is to stand, to move around. So my husband, he's the chief regional medical officer for SSM Systems. The first 6 months of the job, he was just sitting, meeting after meeting after meeting. So he got an elevated desk because he graduated with the same degree program I did.
Right.
He got an elevated desk for his computer so he could look at all the Zoom meeting and do like walking, lunges, keep moving because sitting's the worst. Sitting for anyone is the worst.
It is the worst.
It's the worst. Keep moving.
Yeah, I tell you, I just spent a week hiking in Wyoming, just hiking all day, every day.
The weather's just amazing.
The weather's amazing. Altitude, I think, does something. And something just about walking. I wasn't lifting any weights, but
interesting.
What
do you mean you weren't lifting weights?
I like to lift weights.
Oh, up there.
As my health. I've lifted weights for 50 years.
Yeah. Squirrel. I'm just still thinking about Wyoming and all the beautiful trees.
But just something about hiking up and down the mountains and the trails and hopping rocks and over things.
That's why you're so well adjusted, because you're not a doctor that just works out in a gym. You get exposed to trees, which trees are so healing for humans.
Yeah, so we got to stay moving.
In the nature.
Yeah.
Nature is amazing.
Yeah, as best we can.
Yep.
And I think it's important to do it out in the sunlight.
Yeah, totally.
With sunlight. Okay, so we got to move. And Peter Attia, he's very, very popular, very famous doctor. And I think he just wrote a book on longevity and how just something like grip strength is associated with longevity. Just being strong is associated with living longer. So some kind of resistance. And if we have a sedentary job, we got to make it as unsedentary as possible.
When you see my husband, hopefully, if you can do a podcast for pain management.
I will.
He's an integrative pain management doctor, and he does HIIT workouts every day. When you sit across from him, you're going to see his ripply muscles. He is strong, man. He's strong. And he's
going to live a long time.
He will. It reverses diabetes. It prevents cancer. It prevents Alzheimer's. HIIT workouts are incredible. High intensity interval training. I don't do it. I need to do it.
The best cardio is
do you do that? I don't do it.
I like to push it when I'm in the gym. Hard sets.
Well, see, I'm a yogi. So as a yogi, I really need to be doing weights. Just like people like you that are real strong and built, they need to do yoga. It's a balance.
I tell you what. I have such respect for yoga. I mean, it looks easy. Then you go down and do it. You go, oh, my God, this is tough.
No, it's just breathing. Breathe. If you're breathing, you're doing yoga.
Well, whatever. I don't know, the hatha or the kundalini or whatever they had me do. It was devastatingly difficult. I have tremendous respect.
So awesome. You just tell your students, you lay on the mat, you do whatever you feel like doing the whole hour. It's your time.
Those aren't the yoga classes I've taken.
Really?
They kicked my ass.
Oh, I bet you're better than you think.
Well, thank you. I am getting a little older, but hey, so movement. So, okay, sleep and movement. Now let's talk about nutrition.
You already got this down.
I would say, well, this is where it's really controversial. Because I'm going to talk about Andrew Weil right now, who I respect and I look up to Dr. Weil. I'm not going to call him Andrew. He doesn't know me. But he's big on this Mediterranean and plant-based diet. And I've got to say that eating that way is way better than eating the typical crap that most people eat, the pizza and the fast food.
True.
All right, that's way better, okay? The question is it optimal? And I would say that for, we're all different, all right?
Good point.
And
that's actually a good
we have different genetics, and I'm totally open to the idea that an Anglo person that may have derived from northern latitudes may do better on fat and meat, and somebody maybe down in the tropics might do better on fruits and bananas and papaya or whatever.
Like what your genetics are.
Yeah, I think the genetics could play a big role. So there's no one size fits all.
Oh, I totally believe what you do.
So I think for some people, plant-based is a terrible idea. Mm-hmm. We'll say, well, how can you say that? Well, if we're going to be scientific, there really are no good controlled, long-term, well-controlled studies.
Right.
So a lot of this is opinion.
Right.
And everybody has their opinions, and it's okay.
Oh, it's all over the place.
It's all over the place.
It is.
I know for me, I do a lot better with more meat and fat.
So does my husband.
And almost no grains.
He needs meat.
Yeah, grains are not good for this body, and that fiber is overrated.
Yeah.
Anyway, so I could go up and cholesterol doesn't matter.
I still kept. You were one of the first ones to treat polycystic ovary syndrome.
Yes, my handout.
I still have it.
It went out to all the OBGYNs around. I kept it.
I gave that to so many
And they give it to all their PCO patients and the babies. And the babies.
They felt so good on it, and they got pregnant.
About 30% will then have babies if they have a fertile partner.
This was 20 years ago, Gil.
Yeah, 18 years ago I came here. Yeah, amazing. I handed out. And I just saw, and there is one fertility. His name is Steve Poulter. He's in Long Island. He does a lot of social media. Love the guy. And he's one of the few reproductive endocrinologists that are encouraging a low carbohydrate diet. Doesn't talk about calories. Doesn't talk about that.
You were 18 years ahead of your time.
Well, I stand on the shoulders. The guy who originally figured this out was Banting in 1880 or in the late 1800s.
Modest.
And
this guy's too modest.
Atkins just read about it. I mean, he was the first to tell you he didn't invent it. You just have to have the balls to stand up to convention.
What I usually tell our patients so they don't get overwhelmed is I go, okay, can you do 80% good? Like, can you do 80%
not
of something
perfect.
That's not processed, not overly salted? Yeah. Like, can you just do 80% of your food like that?
With some colors, Jennifer.
Colors. And then maybe 20% you can still have fun.
Yeah.
But like, can you do 80-20? If they can't do that, then I do prescribe intermittent fasting for people if they're into that, because it's very sustainable.
Right.
They can eat within reason during, intermittent fasting is a 16-hour fast with an 8-hour window to eat.
Yeah, and if you have a little window, it's almost impossible to overeat.
Exactly.
Unless you have a disorder.
I did because I love to eat. So I don't do intermittent fasting. I do the 80-20. Like 80-20 works for me. But like I tell them, why don't you do 12 hours of fasting, then 12 hours of a window to eat, then maybe build up to 14 and then 10. And then you're at 16 and 8. But then it's something just kind of get to where people can do it. Because
sustainability.
It's just really hard. Like,
if it's
you see in the gym,
in the gym, you see on January 2nd the gym is packed, and by February, March it's back to its normal number of people.
I think probably if we can get, and Dr. Chris Link always talks about this, you can get enough nutrition into your body, you do not crave. And I am such a sweet tooth. Like I told you, I could eat three Musketeer bars in one sitting. Ask any nurse on OB. Because I'm so nutritionally full, I don't crave, honestly, Hershey's. Like my husband could be eating a Hershey's chocolate bar with almonds, and he was like, you want some? Nope, don't need it. I'm not on a diet. I just don't really need it. But when we're not nutritionally filled, our body craves survival. So we crave energy. So that's always in highly processed, low nutrition food. Yeah. So that's why you see the lines at all these fast food restaurants full, because people are running and running and running through their day. They never give themselves breath. They never breathe. Give yourself space, like in your mind. Like they don't have time and they don't have. It's just awful. I saw something the other day, we need to bring electricity to third world countries and things like that. Great. That's a really noble thing to do.
Okay.
But look at them. They look really happy. Do they really need what we have? Because electricity, now they're doing school at night. Maybe they should be sleeping. Like, is this really a good thing, like, to drive like what we've got? Our society's killing ourselves. We're killing ourselves with fast-paced living, cheap food, cheap everything. Relationships are suffering. You know it. I'm preaching to the choir.
But this is profound stuff. Now, Jen, this is we're talking about integrative medicine today, and this is profoundly important.
It's very,
and it involves health and the whole person, and preventing disease and maintaining health. So that's that. This is right on target. It's right on point that you bring this up. One of my pet peeves, and I hope I don't get a lot of hate mail for this, is missionaries that go in and find these tribes that have had no human contact, and then they all get chicken pox and alcoholism and prostitution, and their societies go to crap. And maybe we should have left them alone.
Yeah, why do we think ours is better?
Yeah.
In some ways it is.
And bless their hearts. I mean, I know they mean well too, because
Right.
a lot of, and so I don't want to be misinterpreted here, but these are these big questions that deserve to be asked.
Yeah, it's very important.
It warrants discussion.
That's like what I just said. They're like, why is she talking about, like, they have power and electricity now? Yeah, but now I saw a clip where they're teaching school at night now. Maybe they'd be at home. Maybe they wouldn't have so much to do. And the kids are happy there. Like, the kids are happy with so little, and our kids are miserable with so much.
Oh.
It's like,
All right.
I get in this whole, my mind goes in these places. Just gets depressing.
Well, I'm going to go on another tangent.
Oh, good. I love your tangents. Let's go.
My boy learned, my boy learned so much.
Boys.
Yeah,
I just know Hunter.
Hunter's 20 and Miles is 13.
Poor Miles.
Miles is huge.
Hunter was the only child.
He's a growing young man as well. But I remember being appalled when we went away to camp with the Boy Scouts. And almost every kid was on drugs. Prescribed drugs, Ritalin or antidepressant or whatever it was. Almost every kid in the morning had to get in line to go get their drugs.
Yeah.
I was just horrified. One kid here, I mean, an occasional kid's going to need some drugs.
Yeah.
But it seemed like almost every Boy Scout had to get their drugs in the morning.
Yeah.
And I found that alarming.
Yeah. There's a lot of great integrative doctors that know how to help those kids.
There's got to be a way
there is.
to promote health
There
without
is.
all these drugs.
Yes. And that's why a lot of the patients seek people like Dr. Link. They seek integrative pediatrics. One of the, I'm not a integrative pediatrician, but one of them, the most simplest thing is we've got a lot of hyperactive activity, inflammation of the brain.
Okay.
So you prescribe this all the time, fish oil. So they taught these moms and dads, just slice open a fish oil capsule, squirt it in their spaghetti sauce. They won't even know the difference.
Don't even know it.
Every single day, put 1 gram in their food. Then trace minerals have to really feed the brain. And trace minerals are so lacking in our soil and in our food.
Well, this goes to number 4.
Yeah.
You were talking about trace
kids.
minerals.
Yeah.
So how do we get these trace minerals, these trace vitamins? I know spices have traditionally been one
You
way.
could do 2 ways. You could, in our body, if we put something in our mouth to get it, it has to go through a gut system. It has to go into our stomach to get absorbed, to become a form of molecule that we can absorb.
Yes. It's not what we absorb, Jen. It's not what we eat. It's what we absorb.
Absorbing.
Yeah.
So we have a highly inflamed society that's creating inflammation, havoc in our bodies. So even though you can get expensive whole minerals and whole vitamins, if you haven't fixed your lifestyle for inflammation, that expensive vitamin is never going to be able to absorb. Maybe 60% of that expensive vitamin is going to get into your system. So we do IV nutrients in our practice.
Interesting. So
We're
gut
bypassing.
inflammation hinders absorption, you're telling me?
So you can do two ways of healing the gut. You can do it through the gut, or you can do it through an IV, or you can do it through sauna. You're trying to get inflammation in the gut down. So our IV nutrients have glutathione. They have NAD+, which are nicotinamide adenine dinucleotides.
Yes.
So you're trying to detoxify the body to kind of speed up the process so that you don't have to get expensive IVs all the time, but at least that gives the body thank you for helping me. Now I can use what you're putting in.
So do you see improvements after?
Absolutely.
Do you have to do a series of infusions? Do you do a half a dozen?
Since the 1960s, you should get 4 total IVs. It doesn't matter if it's once a month, once a week, just 4. By the 4th, your body's nutritionally optimized.
So what's in a bag? You've got glutathione, NAD.
Ooh, ours is special. There's really great clinics everywhere. There's in fact one here in Columbia, Prime IV. Okay. Mine is in my own office. But
so where do you get the bag?
Oh, we actually mix them like a cocktail. We call it a little cocktail bar. So I put 15 ingredients in one 500 little cc bag. That's 2 cans of soda, real little.
So these are IV
minutes.
ready.
Yeah.
So these are pure, clean, sterile,
and they're
IV ready.
They're all methylated for our people that are not able to methylate.
Yeah,
their
and
vitamins.
let's explain that. When you
I don't know much about it. I hope I can do okay.
when you take folic
Oh, no.
acid into your body,
Yes.
it's not active.
Okay,
it has
this I
to
don't know.
dissociate
This is
into, has to
this.
dissociate into
Okay.
folate.
Okay.
And it's still not active. It's supposed to be a methyl donor. Then it has to get methylated. Now it's methylfolate. Now it can do its job to methylate and put carbons on things. So it has to get activated. And that's this.
Is that what you tell your patients to take as methylated folic?
Yeah, especially if they have high homocysteine, and if somebody's gone ahead and got an MTHFR test and they've got this, particularly the more I don't want to call it the worst mutation, but say the more severe mutation, or if even is it even fair to call it a mutation? Let's say variant, because there may be benefits to these things. Well, then the methylfolate will certainly get past the inhibition.
You explained that really well, because all I know is our patients will tell me, I need the methylated one, and then we got the methylated.
Yeah, and they used to be very expensive, and now you can go on Amazon and get very, very cheap, or I can't vouch how strong they are or potent they are. But it's methylated vitamins are much cheaper now, it seems. So you've got methylated vitamins in your cocktail. Glutathione.
We got glutathione. Glutathione's an extremely. It's like we make it in our liver. Everything that we put in those bags, we make in our body. But with stress and aging, we use up all our glutathione levels.
Yeah.
That's why your kid, when Hunter had the flu when he was little, he's like, "Ugh," throw up. The next day he's out in school again. He's happy.
Right.
We throw up. We're like still recovering for a week after flu.
Right. It takes longer to recover.
Yeah, kids have high glutathione levels. With every illness, every sickness, every impact from our environment, our glutathione levels go down. Why? Because it's a potent antioxidant that's trying to gobble up free radical to heal damage in the body.
Okay.
NADs, what they do is they kind of go backwards in the cycle, the Krebs cycle that I just memorized before the test. But it's the mitochondria powerhouse. So what it does is it goes in, it makes more ATP so you can heal your body. That's the idea why you're doing these podcasts. You're trying to get people to heal themselves.
I am.
Right.
With accurate information from experts.
Right.
Correct.
Exactly.
That's why I do this.
So back to your question is you could take really good quality vitamins, but if you know that your gut's inflamed, you don't poop well. Your poops are rabbit poops or they're runny poops. They've got to be a large banana solid poop at least 10
nobody
times
wants
a
to
day.
talk about this,
Nobody
but this
wants
is
to talk about
important.
poops.
What did I say? We said at least once a day? You should poop once a day?
10 times a day. At least
No.
10 to 15 times.
You should poop 10 times a day?
That's how regular. If you eat something, you get bloated right away. You're backed up. I'm backed up. Like my system's horrible.
Wait a minute.
I've never been a good pooper.
Time out here. I can't imagine pooping 10 times a day.
It should be 10 times.
Well, I don't know.
Big solid banana poop.
How can you even eat enough?
Well, if you are pooping, what you're doing is you got good gut bacteria and you're pooping all the toxins out of your system.
Well, what I'm going to say, Jen, I'm going to take this under advisement. I don't think I'll ever poop 10 times a day, but I will say that you have information, and there's people that think that more poops a day is better if they're well formed,
like a banana,
and you're not super gassy, not super runny.
My commission rate's gone down. Sakara is an extremely good program. I don't really like their foods very much. I know I'm ambassador, but their foods, they're good. But I get more out of this thing called a super fiber. And what they've done is they've just really put a good fiber together. I'm not advertising, but that's how I poop. I just put one scoop in my smoothie, and I use their proteins and greens. So I'm getting my detoxifying greens in my system.
So you like making shakes?
Yeah, I'll do detoxifying greens, proteins and greens to get my protein. It's all plant-based. I'm more of a plant-based person.
Plant-based, okay.
But
and it might work better for you.
Yeah, it does. And then I'll put my super powder in there, and I poop. It's glorious poops. But guess how much I've been sick? Because I'm a poor pooper. You take anyone that gets sick frequently, they're a poor pooper. Yeah, if you poop really well, you rarely get sick. My husband.
George Carlin, one of the greatest comedians.
Yeah.
He goes, give me the bacteria. Goes,
Yes.
in and out my colon.
He was brilliant.
He was brilliant. He says,
was brilliant.
I don't get sick, he says. It goes out my colon.
And how long ago was his stuff? I loved his stuff. Why is a driveway called a driveway? Why is a parkway called a parkway?
Oh, I could go on and on and on. Love George Carlin. But he said, look, I'm going to be strong, expose me to all the bacteria you want, because my immune system kicks it right out my colon.
You know what I wish I did for 20 years as an OB? I wish at the end of the career, they were, my patients bring this information to me. They did things like, if you have to have a repeat C-section and you're group B strep negative, get that little gauze pad in the woman's vagina.
Yeah.
Put it in there. It doesn't matter. There's no standard minutes. Then when you're just holding your baby, just wipe it gently. Wipe the bacteria on the nose.
Yeah.
But the group B strep has to be negative.
My wife's obstetrician made sure that the C-section baby, he'd put his finger in the vajayjay and put that finger in the baby's mouth.
What year was this?
I guess it was 13 and a half years ago.
He was way ahead of his time.
Oh, yeah. He's passed away now. I can use his name. His name
I know
Bill,
exactly who
Bill
it is.
Trumbauer.
I knew it.
Yeah.
He
would call it, because when a baby, our audience needs to know that we are covered in bacteria. Our guts have to have good bacteria. And where do baby get their bacteria? They come out the birth canal.
That's amazing.
Mouth first.
I never knew this.
Nose first. And we need to be colonized when these bacteria.
Yeah.
And in a C-section, you're avoiding that.
Too bad he's gone.
Yeah, bless his heart. Yeah, so we need to be colonized.
We got trained at the same place for hormones. American College or American Anti-Aging, whatever, for hormones, A4M.
Yeah, that's right, A4M. Yep.
They miss him too. He was such a great doctor.
We miss Bill. I still think about him. So the final pillar of health. What was the fifth?
Hormones.
Hormones. Now we've had a number of. It reminds me of that horrible teenage joke. How do you make a hormone?
How?
No? You don't pay her, right? I can't believe I said that. I can't believe
I'm going to use it. I have to have material when I'm doing exams. I'm totally going to use
terrible.
it. It's great.
I'm going to get hate mail from that one.
To get more views.
So anyway, hormones, a huge topic. Dr. Elizabeth Wilson has talked to us about hormones.
Good. She's good.
And since I'm a hormone doctor and endocrinologist, I talk about this all the time. But give me a general overview, Jen, because we're going to have to come to an end here. We have to, because you and I could talk forever.
Both men and women have them.
Okay.
Do not ignore men. They need hormones
we
too.
all need hormones. And in fact, I like watching. I go down these rabbit holes on YouTube, and I like watching these bodybuilding videos of old, and what people did, and all these incredible physiques, and when steroids. And there's a guy right now. His name is Israetel. He's a PhD exercise scientist, and he's been talking lately about all the steroids he's taking, and he's really bulked up, but he's got these twitches, and he will tell you how it's going to hurt his heart, and it's going to hurt his liver, and it's going to hurt his kidney, and all this kind of stuff. But people take these hormones because they want to look big and strong, and they will suffer. They'll rob Peter and pay Paul, as it were. So hormones certainly can be abused and whatnot, and it's not fair just to use the word hormone because it's a whole endocrinology.
Because people don't understand what it is,
a whole world. But give me the integrative medicine overview. Give me some concepts, Jennifer.
Where should we start? Okay, find out.
Like you mentioned, when the person comes in, they throw the pen at you. They're irritable.
Okay. Whatever age you are.
Okay.
You can have hormone imbalance. So we've got 17-year-olds, 12-year-olds on hormone, what are they on? Birth control pills? They have hormone imbalance. We've got 20-year-olds, 30-year-olds, 40. It doesn't matter what age. They're going to have hormone imbalance. But you have to figure out why. Yeah, you have to figure out why. So I always start with, okay, are you a type A person? Do you push yourself so hard that you have high cortisol? Do you have hypothalamic adrenal pituitary burnout? It used to be called adrenal fatigue. Right.
And there was all this debate whether it's a real thing.
Google changed it. Now they actually say it's a real thing. It used to say
and
no.
it depends on where you draw the line in the
Right.
sand.
Right.
But I think any thinking doctor realizes that
It's
a
so
person
real.
under chronic stress
Yeah,
has
absolutely.
chronically elevated stress hormone, cortisol being the classic one.
You said it.
And eventually,
You said
especially if
it.
you don't have the nutrients
Yep.
and the minerals
Yep.
and the precursors, and
So at least
you're not going to
address
make enough.
that first. Like figure out if they can make any lifestyle changes
Mm.
to make less stress. Is it a bad boyfriend?
Mm.
Is it what you're eating? Like, again, back to nutrition. It's the whole body. It's that visit that they spend with me. I'm covering the whole body because you can't just treat and give them hormones. At A4M, American Academy of Anti-Aging Medicine, where Dr. Trumbauer was trained as well, and my father,
Yeah.
they say don't be hormone slappers. Don't just be slapping hormones into people and not correcting anything with their stress. Because if their stress is constantly there, it's driving their hormones down. So it's like a teeter-totter. I have a little bumper sticker that says hormones and cortisol play together. A teeter-totter, is a board. It goes up and down. If your friend weighs more, it's going to go down, you go up. If you put more weight down, they go up, you go down.
Okay.
So if you got more cortisol, hormone levels go down. But if you can just bring your cortisol down, just maybe you can make your own hormones. But second thing is you always test for hormones. Never just go on hormones. Like test them.
How do you?
Ooh, there's so
test?
many. There's so much debate.
Right
now,
so much testing.
The three methods are, let me get this right: blood, saliva, urine.
Yep.
So blood is like you get venipuncture.
That's the
you get phlebotomy,
standard.
and it goes through insurance. I start with that. Then, if you want to test your first problem, which is you're thinking that might have like adrenal fatigue or high cortisol, you're going to test cortisol, but you got to do it throughout the day. So the only accurate is how'd you know saliva and dried urine?
Well, because it's really the
always
only in standard because in standard medicine, if you're diagnosing somebody who's making too much, there's 3 different tests. You can test. You can carry a jug around and get what's called a 24-hour urine collection. You can measure the blood in the morning, and you can try to suppress it with something called dexamethasone. And there's another way. You put a cotton thing under the tongue. I think at 10 p.m. Now I could be wrong, and then that gets soaked up, and that is a recognized, legitimate measure of your cholesterol, of your cortisol production.
Yeah.
It's from salivary. You put it in there and it has to get soaked up, and because you can actually now measure it. It's a standard amount. It's a standard time.
Yep.
So that's it. But as far as measuring your saliva, spitting in a cup, and measuring dozens and dozens of hormones, still very controversial because the more hydrated you are, the more dilute it is.
Yeah,
so you need to standardize.
You're probably just looking for a curve. So whether you're using saliva or urine, dried urine testing, Dutch,
oh my chiropractor, Jeremy Maxwell, my friend. He's had a lot of
way.
That's right. He's done a bunch of podcasts with us. He's a big Dutch test guy.
Yeah,
I love him, and
just looking for a curve. Just make sure the cortisol curve is pretty normal. You know? And that's where you get a lot of gut disturbance. You see a lot of gut problems if their cortisol curve is completely flat. In those patients, you've really got to go back again to the gut. And those require probably people like Dr. Maxwell, Dr. Chris Link, Dr. Carrie Vaughn in Jeff City. They're all functional doctors. Dr. Bonnie Freeling's here in this town.
Okay.
She's great. She used to see me too. They try to fix the functional problems in your gut.
All right, so we don't have to get into specific hormones, but we can say the concept, the overarching concept, is if we
fix the cortisol
but we can fix the cortisol by improving stress, identifying the stressors, the things in your life that you can correct, and you can't do that in a 6-minute visit. It takes some time and a caring doctor who's done this a couple times to be able to identify these fixes. And so you're not going for an individual hormone, you're going for a healthy lifestyle that results in a healthy, let's say, hormone environment. Is that fair?
Because that's why, you'll have friends that say, man, everything worked great on my hormone replacement, and then now it doesn't work anymore. Well, did they talk about your lifestyle, your gut? Did anything get fixed with your stress levels? No. So that's why people go up and up on their hormones, and they're wondering why it quits working after a while. You've got to really take the whole person, or else we just become hormone slappers. But Dr. Mark Grant here in town,
Love-
he was the first integrative. Oh my gosh, he's so awesome.
This is great. I'm plugging
You,
again.
him-
He did a whole podcast on testosterone replacement in
he's
men and women.
so good at
Look it
hormones.
up. Mark Grant.
He's very good.
He's episode whatever, 30 or 40.
I trust everything he says. He's taken care of our patients for 25 years. They love him.
All right,
You
you're
and
plugging
him,
my other podcast.
Dr.
We're good friends.
Dr. Penny, who I think's passed away now.
Larry passed away. I bought
Then
his
you.
practice. I inherited his practice.
Dr. Mark Grant. All of you are like, kept our patients so healthy.
Well, this, coming here 18 years ago to Columbia, Missouri was really an amazing move for me because I appreciated early on the community here, and it includes Jefferson City too. The community here in mid-Missouri is just amazingly talented and supportive and collegial
supportive.
and all that kind of
Exactly.
stuff. It's a really good place to be. So, Jennifer,
What?
in wrapping up our wonderful discussion on integrative
Yes.
medicine that could go on forever.
We could talk about this forever.
Forever. I'm going to highlight that the points of integrative medicine are to maintain health and well-being and not just treat diseases.
Nice.
It involves educating patients. It involves bringing in research where it's appropriate. It also things that we have not talked about. We don't have time right now, but ways that this called Can Heal. It's where you're treating people with cancer who are getting treated, helping them heal from cancer. This can certainly be an adjunct to your chemotherapies and your radiations. The whole field. I'm going to have somebody on to talk about therapeutic psychedelics.
Ooh.
The psilocybins, the
Ooh.
ketamines, the MDMA, the ecstasies in
Nice.
small doses with proper counselors, and are showing incredible promise for
That would
mental
be an
illness.
amazing.
Oh, I'd love to know more about that. And now that these things are getting descheduled, they're getting moved out of Schedule 1 into places where they can get the research they deserve. Very fascinating. And that we could call
That
that
would
part
be
of
amazing.
integrative medicine. We talked about a little bit about prevention today. We've talked about nutrition and herbs. We've talked about the support you can give somebody. We've touched on anti-inflammatory diets and anti-inflammatory
Yeah, absolutely.
lifestyles. Talked about well-being where you work, things you can do, because we spend a lot of time at work.
Yep, everybody does.
And there's things that we can do while we're at work so we can get up and move. For me, it's keep the donuts away from me.
Absolutely.
Right. I can't eat if I eat one bite, I'm going to eat
Oh, I'll eat
the whole box.
I'll eat the whole box.
Can't eat the
They're
donuts.
delicious.
And if they bring donuts to your work,
Who
you
doesn't
get-
love donuts?
people who know me, Jen, they bring me jerky and cashews and stuff.
Oh my
and-
gosh,
and
my patients do that
pistachios.
too.
Yeah,
They're bringing me almonds and tomatoes.
Although almonds have lots of lectins. Dr. Grundy, an interesting guy.
Oh my gosh.
See, he's
The
he's
Super
got-
Reds, or what was
yeah,
that
Yeah,
called?
yeah. He
Do you have
doesn't
him on
like.
your podcast?
No, I don't.
Oh, he'd be
we'll
great.
get him on eventually as we grow. We'll get more famouser people. And but with almonds have lots of lectins, and so I haven't been eating as many almonds and,
Interesting.
and all that kind
My
of
husband
stuff.
will come in our office. He's like, it's Christmas time. Where's the cookies and the homemade? I go, our patients here don't eat that stuff. Like,
You've
they
got
aren't going to
some
bring that here.
pistachios, really nice pistachios from the Middle East, freshly flown in.
Is it better from the Middle East?
I
that
think
like-
Iran is famous for their pistachios. I believe that the best pistachios come from Iran. Now, with the political things going on, I don't know. The second is California, but I think they're best from Iran. I don't know. I'm just remembering.
They're delicious.
That. Yes, so love that. So, and the final thing, being healthy. We're not going to say everything that's organic is good for you, but let's just say in general, I think we all agree the more natural, the more colorful, the less processed the food.
Very well said.
Probably better for you.
Very well said.
All right, we all agree
Yeah.
on that. Well,
Yeah.
good. Well, Jennifer, what a delightful discussion.
Thank
We
you.
went
That
on
was fun.
a lot of tangents.
fun.
I hope our audience is able to follow
I hope
our,
they kept
our
listening.
weave,
They were like,
our weave as we
I
go.
know. Squirrel.
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 Good. Well, listen, I've really enjoyed this. I've learned a lot
Oh,
from
we've always
you.
gotten along.
And I'm so proud of you that you listened to yourself. You realized you were burning out, working 24/7, and that you made a positive change in your life. And now you have better hours, and you're the only doctor I know that now teaches yoga.
Are you serious?
Yeah.
Oh my gosh. In my integrative medicine class, there's other yoga teachers. When I first met them, I'm like, you're a yoga teacher? That's weird. And then I became one.
That's so fantastic. Well, Jennifer, thank you for your time. And I'd love to have you back sometime.
Would that be fun? Get my husband up here?
We'll get your husband in here too.
Okay.
What a pleasure. Thank you.
Oh, thank you so much for what you do.